environment. We've heard a lot about substance abuse during this pandemic, and now one focus is on teens who are struggling with the issue. It's estimated 50% of teens have misused a drug at least once, and that 15 million need treatment, but only 1 in 10 receive it. Joining us to talk more about this is Dr. Carrie Pichie, a clinical psychologist and the Regional Director of Ambulatory Services at Hartford Healthcare's Behavioral Health Network. Doctor, welcome.
Thank you for having me.
Thanks for being here. So what are some of the signs and symptoms that a teenager might be having trouble?
It's very important to look at any changes in behavior or functioning in the teens. So things like social isolation or a change in mood. They might become more irritable or engage in behaviors that are sneaky, even more disturbing than that, starting to lie to their parents, etc. There can also be physical changes, decrease or increase in appetite, decrease or increase in sleep, a loss of energy. So really being in tune to the teen and noticing anything that's out of the ordinary.
All right, tell us about how COVID has impacted teenage substance abuse.
If we think about a life in a teenager's, a day in a teenager's life, really, they're usually in school most of the time. So when you think about in COVID times, the move to virtual learning and hybrid learning, teens are really home most of the time at this point, even extracurricular activities such as sports being canceled. So they're spending more time at home rather than in school and in these activities. And as a result, the adults in their lives, like their teachers or their coaches on the sports field, have less interaction with them. So really, there's more isolation, spending time at home more, which gives them more opportunity, perhaps dabble in drug use. And then there's the whole context of social media and television, et cetera, which might be glorifying the use of drugs that they could be exposed to at a greater rate at this point.
Great point, yeah, about not being around teachers or coaches. All right, Natchog Hospital offers a treatment approach called 7 Challenges. What does that entail?
7 Challenges is an evidence-based treatment model where we really rely on the person coming into treatment to meet them where they are and to motivate them, as opposed to what we know is that traditional approaches of forcing teenagers into treatment and telling them they must stop and they must quit. Really, that doesn't work. So what we try to do is use a motivational type of treatment where the adolescent themselves realizes what impact the substances are having on their life and how stopping those can better their life.
All right, real quick final question. Your upcoming education session on teenage substance abuse. Tell us a little bit about where we can get information.
Sure. We're having a virtual webinar this Thursday with further details about what we talked about today. And that's on January 28th from 6 p.m. to 7 p.m. And you can register online at hartfordhealthcare.org/virtual classes or by calling 855-HHC here.
Excellent. All right, Dr. Carrie Pichie, thank you so much for being with us.
Thank you for having me.
Thank you.